Hello everyone, this is Arvind Kosaria and today's topic is fungal infection by geotrichosis. Geotrichosis is a fungal infection caused by a Geotrichum candidum. Trichum candidum is type of yeast that is commonly found in the environment including soil, air, water, plant and dairy products. Geotrichum candidum belongs to the kingdom fungi, phylum Escomycota, class Saccharomycetes, order Saccharomycetales and family Trichosporinidae. Additionally, it is a member of commensal human skin gastrointestinal tract. While Geotrichum candidum, often considered as a harmless commensal organism, it can become pathogenic if individual with a weak immune system or underlying health condition. Early discovery and case report. 1847, the first documented case of geotrichosis was reported by Dr. John Hughes Bennett in Scotland. He described a patient with a tuberculosis who has secondary infection caused by Geotrichum candidum. Then in early 20th century, primary focusing on pulmonary infection. This report helps to establish the Geotrichum candidum as a potential pathogen. Then in mid 20th century, as a medical knowledge and diagnostic technique advanced, the geotrichosis was increasingly recognized as a opportunistic infection, particularly in the individual with weak immune system like immunocompromised patient with the rise of HIV, AIDS and other immunosuppressive conditions. Then in modern era, the ongoing research and clinical understanding has expanded our understanding of geotrichosis, including epidemiology, clinical manifestation, diagnostic tools, and treatment. Geotrichum candidum have a primary use on the cheese production, reinformation, flavor development, fermented dairy product, and bioremediation, and industrial application like enzyme production. Geotrichum candidum can affect various parts of the body, leading to different type of infection. First one is pulmonary geotrichosis, and this pulmonary geotrichosis is categorized into two: bronchiogeotrichosis and bronchiopulmonary geotrichosis. Bronchiogeotrichosis. This is most frequent form of geotrichosis. This type primarily affect the bronchial, often causing symptoms similar to asthma or chorionic bronchitis. B. Bronchiopulmonary geotrichosis. This is most severe form involved in both the bronchi and the lungs, leading to cough, fever, and difficulties in breathing. Second one is cutaneous geotrichosis. This is also subcategorized into two. First one is superficial geotrichosis. This type affect the skin fold such as groin, armpit, intergenital space and causing the itching and a rash. Deep geotrichosis. This is a more serious form, can lead to nodules and tumor and an ulcer on the skin. Third one is oral geotrichosis. This type of factor causing white patches on the tongue, inner cheeks and gums. It is often seen in people with a weak immune system. Fourth, dissemination geotrichosis. In a rarer case, the infection can spread to the other part of the body such as heart, liver and kidney. Diagnosis of geotrichosis. Diagnosis typically involve the combination of clinical evaluation and the laboratory test. First, a clinical evaluation: respiratory symptoms, chronic cough, shortness of breath, chest pain, mucus production. In skin, rash or skin irritation. In gastrointestinal, diarrhea and abdominal pain occur. In oral, white creamy patches on tongue, inner cheek or throat, soreness or burning of sensitivity. These are the symptoms of clinical evaluation of geotrichosis. Laboratory test. Microscopic examination. A direct smear. Sample from the affected area, example sputum, skin, scraping, oral thrust, can be examined under a microscope to identify the fungus. B. Histopathology. Biopsy sample of affected tissue can be examined under the microscope to identify the fungus in a tissue. C. Culture. Sample can be cultured in appropriate media to grow and isolate the fungus. D. Molecular testing. Technique like a polymerase chain reaction (PCR) can be used to detect a genetic material of the fungus. One specific point is there: the specific laboratory test used may depend on the suspected location of infection. Example, if pulmonary geotrichosis is suspected, sputum culture and chest X-ray may be performed. Treatment for geotrichosis. The treatment often depends on the severity and the location of the infection. Common approaches are: first, for pulmonary geotrichosis, antifungal medication. Amphotericin B, flucytosine, or a voriconazole are often used. Supportive care. This may involve oxygen therapy, respiratory treatment, and management of any underlying condition. Second, for cutaneous geotrichosis, typical antifungal medication, ketoconazole and miconazole cream or ointment can be effective for mild case. Systematic antifungal medication. In severe case, oral or intravenous antifungal may be necessary. Treatment may vary depend on the specific body part affected. It's crucial to consult with the healthcare professional for accurate diagnosis and appropriate treatment plan. Self-medication can be dangerous. There are different types of prevention for geotrichosis. First, manage your underlying condition. If you have a condition that weaken your immune system such as HIV, AIDS, diabetes or cancer, work closely with your healthcare provider to manage it effectively. Second, avoid unnecessary exposure. Limit contact with soil, plant and other potential source of the fungal infection, especially if you have a open wound or a respiratory issue. Third, practice good hygiene. Wash your hand with frequently, especially after gardening or handling the soil. Fourth, follow medical advice. If you are immunocompromised and have been diagnosed with the geotrichosis, adhere to your doctor to treatment the plans. Fifth, maintain a healthy lifestyle. Practice safe food handling, maintain clean environment, etc. So these are the introduction, history, type, diagnosis, treatment, and prevention of a geotrichosis. Thank you.